Hello everyone, Dr. John Bartemus here today to share an exciting study with thyroid patients. Do you have hypothyroidism? Do you have Hashimoto's disease, which is autoimmunity against the thyroid? Do you have hypothyroidism induced by damage from the Hashimoto's disease? Well then, this video is important for you. A study out of the journal Lasers in Medical Science looked at patients with hypothyroidism that was caused by Hashimoto's thyroiditis or autoimmunity against the thyroid. And what they did is they wanted to study how low-level laser therapy would impact thyroid function and the process of the Hashimoto's disease and hypothyroidism. So what they did is they took a group of hypothyroid patients caused by Hashimoto's and they treated them with laser, and then they had a control group that they did not treat with laser. In both groups, 30 days after treatment ended, they took them off their levothyroxine or off their Synthroid, off of their thyroid medications. And they followed them for 9 months. So they stayed off their medication for 9 months. And what they did is at the end of 9 months, they reintroduced the medication to see how much medication would be needed to normalize their blood thyroid levels. And they determined was the laser treatment effective by whether or not the patients that were treated needed more or less thyroid hormone compared to when they started and compared to the control group. Also in this study, they ultrasounded the thyroid to look at echogenicity or thyroid volume. And so the findings are amazing. After low-level laser therapy treatment and 9 months without medication, they found that the treatment group required less medication to get their thyroid levels normalized back in their blood, or no medication at all. Whereas the non-treatment group didn't even make it the whole 9 months without their medication. They had to go back on because their symptoms were so bad. Reevaluating the ultrasound, they found that the thyroid volume in the Hashimoto's patients that were treated was normalized in over 66% of the patients, meaning if the thyroid volume was too low because they've had extensive damage to the thyroid or too high because of the inflammatory process, it didn't matter. The laser normalized it either way. So what this study shows is that cold laser therapy for the thyroid, especially in Hashimoto's autoimmune thyroiditis, which causes hypothyroidism, it is very beneficial on thyroid function. It decreases inflammation, decreases genetic expression of pro-inflammatory cytokines, and increases production of T3 and T4, which are your thyroid hormones, endogenously, so without medications. So if you're looking for a way to naturally slow down the autoimmune process and improve the function of your thyroid and minimize or maybe get off your thyroid medications, this study is huge for you. And I'm a good person to know because I have laser that we can use on your thyroid as adjunctive treatment with your other thyroid care. So I'm Dr. John Bartemus, and if you're looking to optimize your thyroid function so you can live a life at optimal, give me a call. 704-895-2240. Have a great day.